Alterations in mobility, pathophysiology, and management. The musculoskeletal system supports the body and facilitates movement. It also stores many minerals, protects vital organs, and is involved in the production of blood cells. So there's 206 bones in the human body, and they're classified as short, long, flat, or irregular. There are two types of bony tissue. Cancellous is spongy tissue, and cortical is compact, dense, and hard. Bones are made up of cells, protein matrix, and mineral deposits. There's three different types of bone cells that we discuss. Osteoblasts help build the bone. Osteocytes are mature bone cells, and osteoclasts are involved in the destruction, reabsorption, and remodeling of bone. There's two different types of bone marrow. We have red marrow, which is found in the sternum, ilium, vertebrae, and ribs, and it manufactures blood cells and hemoglobin, while yellow marrow is found in the long bones and is made up of fat cells and connective tissues. However, it can take on characteristics of red marrow and manufacture blood cells and hemoglobin if necessary. We have three different types of muscles: skeletal, smooth, and cardiac muscle. Skeletal muscles are independent muscles and they promote the movement of the bones. Smooth and cardiac muscles are both involuntary muscles. Cardiac muscle is found only in the heart. Smooth muscle lines body cavities and is part of the walls of many of the organs, and their movement is going to be triggered by neurotransmitters from the autonomic system. Joints are defined as the junction between two or more bones. We have free-moving or diathroidal joints that are between most of the joints in the body. We also see synarthroidal joints where there's no movement within the joint, and that's going to be the bones that are found in the skull. And we have amphiarthroidal, which has limited movement between the joints. For example, the vertebrae. Tendons are cord-like structures that attach muscles to the periosteum of the bone, and the attachment of the muscle is either defined as being origin or insertion. Origin will be more fixed, and insertion has more mobility. Ligaments are fibrous tissue that connect two adjacent, freely movable bones, and they help stabilize joints. Cartilage is firm, dense type of connective tissue that reduces friction between the articular surfaces. It also helps absorb shock and reduces stress on the joints. Types include hyaline or articular, costal, semilunar, fibrous, and elastic. And bursa are small sacs that are filled with synovial fluid that help reduce friction between different areas. So true or false? There are two types of bones in the body. And this is false. We've got short, long, flat, and irregular bones. There's two types of bony tissue, however. So once again, true or false? Tendons attach bone to bone. This is also false. They attach muscle to bone. Again, true or false? Ligaments attach bone to bone. And this is true. So during the assessment, of course, we need to get a thorough history. Is this a chronic or an acute disorder? What medications, drugs are they on? Allergies do they have? Is there any familial issues with the musculoskeletal system or occupational issues? Have they had a recent injury? And if so, what type of trauma occurred? Do they have an open injury? And if they do, we need to determine when their last tetanus immunization was. If it was within the last 5 years, then they probably will not require another tetanus vaccine. However, if it was over 5 years, they will definitely need one. Now, if it's a really dirty wound, has a lot of debris in it, that time frame can change. We also need to make a list of all of the symptoms the client is complaining of with the musculoskeletal system and determine if there's any effect on their activity because of these symptoms. Physically, we need to assess their motor skills, muscle strength, and is there any wasting of the muscles? We assess the symmetry, size, range of motion, and alignment. We assess for pain, tenderness, swelling, and redness. We look at the spine for kyphosis, lordosis, or scoliosis. Neurovascularly, we're looking for spasms or tremors. We need vital signs, especially if there's any bleeding noted. We also want to look for bruising, any open wounds or debris or protrusion of the bone or tissue. We need to check peripheral circulation, sensation, malalignment of the injured limb. We should always assess distally to a wound. In other words, if there was a fractured ankle, we would be assessing the foot distally to that injured ankle. If it was a knee, we would need to assess the tibial pulses and swelling, temperature, color, etc. We also want to assess their pain. What type of pain is it and where is it? We need to do a neurovascular assessment that would include circulation, and this includes checking the distal pulses, cap refill, skin temperature and color, and edema, checking movement and strength, sensation, pain, and assess bilaterally to determine differences from side to side. This is a list of some of the diagnostic tests that may be completed with the musculoskeletal system. And nursing management. Nurses need to help prepare the clients for any diagnostic tests, diagnostic examination protocols, sending specimens to the lab, making sure there's a safe recovery after the procedure. Also with chronic issues, we need to make sure we get that general medical history, current symptoms. With an invasive joint examination, we would postoperatively inspect for any swelling, bleeding, or drainage, and change or reinforce dressings. With traumatic injuries, make sure we get as much information as possible regarding the injury. Sometimes knowing the mechanism of injury will help us determine the appropriate injury diagnosis. We need to monitor vital signs and the neurovascular status and provide comfort and support. Nurses also need to educate clients with musculoskeletal issues on a bone-healthy diet. This would include adequate intake of calcium and vitamin D, vitamin K, magnesium, and potassium can also help maintain bone density. And we also need to educate our clients on weight-bearing exercises because these can help strengthen the bone.